Good morning, Dr. Gary here, Dr. Gary on the road. We sell dental practices nationwide. We are dental practice brokers. So, welcome to another YouTube today. Today's topic is challenges trying to sell a dental office fully equipped with little, if no, patience. We'll talk about a case study on that today. Anyway, so we're now in 25 states with 10 employees, and we continue to grow. I think we're going to California soon, maybe in 2 weeks. So we continue to grow, and we are available to you now 363 days a year. We take off Christmas and Easter, and it's 7:30 a.m. East Coast time to 9:30 p.m. every day during the week. We'll answer your calls, so please give us a call. Everything you're about to hear is for entertainment purposes only. It's not legal or business advice. Our phone number is 201-663-0935, and our website is dentalpracticeguide.com. So please give us a call, and especially if you're thinking about selling to a DSO, we could be your middleman. The DSOs that we sell to, and we pick and choose the best ones. Every time it could be different. They pay our commission. There's no commission to you if you're a large DSO selling a large practice selling to a DSO. Secondly, based on certain criteria, we can get your legal fees reimbursed at closing. So let's get into what today's topic is. So, case study, we have this doctor that calls, has not seen patients, been paying for the rent, but hasn't seen patients in 11 months. Kept the phone lines open, but just not seeing patients. So the amount of income they had on their practice was very low. We're talking below $30,000 for the whole year. So essentially no income coming in. And they want a value of their practice. They say, well, look, the space is worth a lot of money. Somebody could just turn this thing around. And I've already proven that I did $500,000-$600,000 4, 5, 6 years ago. And your response is, everyone is going to look at the most recent year and put the highest value. And you did less than $30,000 in the most recent year. So this is what affects us. And they respond, what about the facility? Do you know how much it costs to build a facility? Now, we've gone over this topic several times, but we're just reviewing it again today with a specific case study. I said, yeah. But with your few patients, they can start from scratch somewhere else, because that's essentially what they're doing at their place of choosing. And the fact that they will have to build it out, and it will take a year or 6 months, and it will cost a lot of money. Costs have gone way up, labor's gone way up. And what do you have at the end? You have a big banknote and you have no patience, really. But you have a beautiful facility. Everybody comes by, brings you the plants and pictures and wishes you well, but you have no patience and you have a very big banknote. So it makes sense to buy an existing office, but it's just not happening like that, unfortunately. The buyers who can get the thing financed at 100% are just not buying those. However, if you do have a practice like that, it doesn't mean all is lost. Now, I do have a practice that's grossing less than $25,000, and we do have some activity on it. We're asking, I think, $60,000 for it. It has one of the lowest rents I've ever seen, just a couple $100 for 2 operatories. But the fact is, there are some people that are interested. But the amount of time it's going to take, and you're paying rent every month, that we may be able to get a candidate for this one doctor, but you may be better off just putting it out in the open market, because of the months you'll lose every month and paying rent. Somebody's going to come in, they'll renovate the whole space, they won't put a value on your dental equipment. You have to take the dental equipment out and just sell it to a third party. You may get some value there. But I know what you mean. It doesn't make sense. Somebody's going to spend hundreds of thousands of dollars when they can spend very little money and just buy your existing office with no patience. They just don't want to be where you are, usually, is what the problem is. And they want their equipment, not your equipment. and they're getting all the financing. They don't care if it's an extra $500,000. They're so used to being in debt. Well, on this one doctor, we do have one, as they say, they're going to ask like 60,000, and it's just an arbitrary number they came up. I don't know where they came up with that number. They feel that's what they want, so we'll try to give it a whirl. And the rent is extremely low, and believe it or not, we got 2 buyers that are interested. I don't know if it will sell, but we had 2 interested buyers. So even me, it's hard to predict. I didn't think that the doctor would get any play on this. Excuse me. I didn't think that the seller would get any play at $60,000, grossing less than $25,000. But we're getting play. The play is one dentist who retired and wants to get back in the game for very low money because the rent is extremely cheap. We're talking about a couple $100s. He says, I think I'll get back in the game. It's a very small investment to make. We'll see what happens. And another one is a doctor that does have a child and wants to spend a significant amount of home time with the child, but at the same time, like to get out a day or maybe 2 days a week with some very small practice with very, very little gross. And I guess they have a little following or something, patient-wise, and that's what they're going to do. So it's a hybrid because I'll never know what the value of that office is until somebody puts a bid in. That's it. We won't know the value until someone puts a bid in, and the bank will finance it. So the bank could do that as, so to speak, a startup, and that's where they'll get funding for a much larger project. Or a small project, they'll do it. So anything goes. But in this case study, this one doctor that called, I don't know what to tell because that's going to be a tough one. It's in a professional building on the upper floor. We can start marketing and advertising it and see what happens. We generally don't do those really small ones, but we try to, out of common courtesy, try to help out. It'll be interesting to see, but it's all be buyer driven. So what the buyer thinks it's worth, that's the answer. What does the buyer think it's worth? But don't waste a lot of time waiting for the perfect candidate. If you have rental space, you're better off at least opening it to the open market. That is the open retail market, commercial retail market. Open it up so you have exposure to different fields that may be interested in it. Because waiting for a dentist to buy it could be challenging. And it may take a very long time, and then you're going to get eaten up with the rental every month. So that you got to take that in consideration. Anyway, thank you so much for listening. Today we got a great day in New Jersey, 24 degrees. Oh, it's 30. Went up to 30. Big deal here. I can't wait till it gets warm again. But we're going out to California. Got a great trip coming up there. I think it's going to be county, Los Angeles County. And then we have another one coming up. And that one we work with a realtor broker. And then the other one's going to be New Mexico. That's going to be exciting. The New Mexico trip's going to be great because it'll be near the White Sands National Monument. And I'm really excited. They have an office right near there, almost on that road. So that's going to be great to see that. So I'm excited. All right, team, we're on the road. Dr. Gary, looking good. Hope to talk to you soon. Bye now.